afternoon all, and thank you for joining us for the webinar on Wellness Strategies from Engagement to Measurement in partnership with Sanofi. I am Rohit from People Matters, and before speaking about today's agenda, let me give you a brief about the topic. With healthcare expenditure skyrocketing year by year and wellness budgets getting limited, it creates challenges to HR leaders in engaging employees in wellness activities. And while wellness programs have proven effects on reducing absenteeism and improving productivity at the workplace, many of the HR leaders have many challenges. The webinar will cover the following challenges. First, what kind of wellness activity engages employees of all levels? Second, what wellness activities will give quick payoff? Third, of the many options in the market, what wellness activities needs to be prioritized? Invest your 1 hour in finding out how can you do more with available resources in today's competitive environment. Let me now introduce you to the speaker for this webinar. We have the privilege of having with us Prashant Operations Leader, India Wellness and Benefits Team, Healthy Cerner Center at Bangalore. Prashanti is an operations leader in the Wellness and Benefits team at Healthy Cerner Center based out of Bangalore. Prior to joining Cerner, she was working with Aon as the benefits consultant for global corporate, which gave her an uncommon exposure and experience in the benefits and wellness space across industries. Our partner for today's webinar is Sanofi. Sanofi is a healthcare organization with their healthcare solutions available in more than 170 countries. Sanofi addresses adult healthcare challenges by preventing diseases, reducing health-related risks, and supporting in living life to the fullest. We have saved time for you to ask your questions at the end of the webinar. For those attending the live webinar, you can submit questions at any time during the presentation through the Q&A section. We will try to respond to as many questions as time allows. We have an exciting agenda for the webinar today. So without any further delay, I'm going to hand over the webinar to Prashanti. Over to you, Prashanti.
Good afternoon, all. It gives me pleasure to be connected via this medium and sharing thoughts around wellness strategy, engagement to measurement. And thank you for this kind introduction. And I would like to thank People Matters and Sanofi as well for this. Well, I represent Healthy at Cerner, which is an internal brand of Cerner representing wellness initiatives. I take care of operational aspects as operation leader for wellness and benefit space in India. As most of you may be aware that Cerner by itself is a healthcare IT company, and for us, our first client is our own population, and our emphasis has always been on maintaining health and care of our associates. We call ourselves a living lab, and why we do so, let me unfold the same as we talk through our lineup items. Today, I would be covering certain key elements around challenge, that is, what is good to have versus need to have wellness initiatives, market options which are at our disposal, and which wellness program would justify as quick payoff program models, and what is the engagement program that we have to put our emphasis on, and what we prioritize. As you all are aware that healthcare expenditure are skyrocketing year on year. And with limited wellness budget, it creates the challenge for the HR leaders which they are facing in engaging the associates in wellness activities. Well, I would say of all the challenges which I have seen in span of my career in various segments and working with many of the corporates, I have understood it as budget or a camouflage answer as budget when they could not find the right answer for what they are looking for. Now with healthcare inflation at 14 to 17% every year in India, and in selecting right programs for associate, the balance between good to have program versus need to have program is becoming a greater challenge for employers. And even if we know about having certain programs which would yield certain results, the question of what next lingers as it is something which is left as is by some or thought about by others. When I talk about good to have versus need to have, now good to have programs are a tick against an HR calendar with no or minimal yield. For sure, they stand as a great engagement platform, but they nullify the ROI factor altogether. Need to have programs are more to do with choosing the right program with clear forecast of what next and what will be the ROI which we expect or anticipate. As we deep dive, let's move ahead in knowing what market has in store for us. Well, an increasing number of employers across the country are utilizing a preventive road to healthcare by providing wellness programs that involve on-site screening and consultations to better predict the potential health challenges of their employees. This information is now being used to direct focus on symptom, or what I call them as symptomatic-based intervention programs. Now, with the growth of wellness industry over the past 2 decades, professional wellness industry players have devised new methodologies or tweaked older ones to suit different organizational needs. There are a number of elements and methods available for employees to gauge their corporate wellness quotient. Now, each organization must enlist options available or choose programs tailored best to achieve their long-term goals or objectives. I would say the simple trick to start somewhere is to review your last 5 years claims data or the claims pattern, or just do a health risk assessment or any structured program for your associate population as the need be. Now, when we always talk about what is the quick payoffs, well, I would say when you say quick payoffs, how do you define quick? For each one of us, the definition of quick varies, but when we take into account wellness program, they have a proven pattern of showing their returns. Now, each program, which is well designed and implemented, has its own return. But it should be noted that ROI from health risk assessments have the highest impact, as they are always done in conjunction with other interventions such as newsletters, workshops, coaching, structured program, or condition management programs. Now, health promotion experts believe that HRA produce the best result when delivered at comprehensive health fairs and are followed up with other wellness activities. Extensive research suggests that implementing wellness programs or conducting structured programs at the workplace not only reduce direct healthcare expense, but it also ensures a more productive workforce, in addition to reduction in employee absenteeism and turnover, or increasing the employee retention, which is prime for us, and having fewer claims amongst all other things. While these factors may seem immeasurable, studies in this area have proven that it would create savings for the company in the long run. Let me discuss certain factors which we all are aware and have made a room in our wellness and benefits discussions. Now, factors which most of our HR folks look for would include, first and foremost, reducing absenteeism. There are numerous factors that control a person's health and well-being, ranging from a minor infection like a cold or a flu to a major one like a heart disease or diabetes. Any of these could cause an employee to take time off work. A well-rounded or a comprehensive wellness program can therefore help reduce absenteeism and save costs to the company. As per one of the survey by the Art of Health Promotion reports that companies who have incorporated wellness programs have realized a 30% reduction in medical and absenteeism cost in less than 4 years. And that's a great study. Now, the second factor we always look for is increasing the productivity. Now, this is a real-time situation wherein we often see employees are at work despite an ailment or an illness, which invariably reduces their productivity. During this time at work, while the illness spreads to the coworker, it further reduces productivity of the group as overall. One person arriving at work with early symptoms of flu can spread the flu to 25% of the workforce if vaccinations are not offered at the workplace. And the top 3 ailments that lead to the decreased performance of work, which has been seen as a pattern, include headache, backache, and musculoskeletal ailments. All these can be prevented or helped with regular exercise. In addition to poor physical condition, which increases the probability of accidents or often leads to injury or increased medical insurance claims. I would ask you all to check the claims on musculoskeletal ailments for your associates in the last 5 years to understand this factor much better. And this is a proven record in Cerner as such. Now, the third factor which we all look for is increasing the job satisfaction. The absence of illness, injuries, or other health problem allows employees to perform better on a regular basis. A positive attitude, moral boost, or high energy levels all go a long way in work effectiveness and hence improves job satisfaction. And I'm sure we all agree to this with full marks. The fourth one, which we all are having as a prime hold, is employee retention. Now, as per the survey of American Association of Occupational Health, 78% of employees said that they would participate in a company-sponsored wellness program. Well, wellness in itself is a great retention tool. So let me repeat this for you again. Like 78% of the employees said that they would participate in a company-sponsored wellness program, and over 50% said that the wellness program would encourage them to remain at their current job. Employees tend to stay at jobs that they enjoy and leave that they do not like. When an employee is not feeling well at office, be it from consistent illness or otherwise, tend to transfer their bad feelings onto other employees and company as a whole. All of these side effects of being unhealthy contribute to employee turnover. Just as a disease is contagious, so is the bad attitude, and you can see the turnover happening in waves as a result, and I would call this as a part of social and emotional well-being. Last but not the least, and my all-time favorite, would be disease prevention. Complications from diabetes and illness related to obesity are the second largest expense to our healthcare system. Running a condition management program always pays off in long term from the perspective of claims and also associate productivity at work. So, what do you think are the programs that produce the best ROI? While no particular health promotion initiative can be identified as one that produces the best ROI, but there are a set of best practices that have been identified from a series of benchmark studies and from the experience that Sana has, and have been known to be a part of effective program. And this would include and start with the organizational commitment. Or commitment is prime, and it is necessary and stands as a backbone to run a structured wellness program. Second one could be incentive for employees to participate. Third is effective screening and your what next factor of aggregate reporting. Fourth could be easy access to wellness resources. So your wellness resources could start with your primary care physician, your consultations with your nutritionist and health coach or care coordinators, your wellness sessions, structured fitness programs. And the fifth one could be effective implementation of programs, and this has to be based on aggregate reporting of risk factors. While you implement a program, you have to do an ongoing program evaluation or tune it based on the change in the risk factor. Now, these are your prime, I would say, program structures that you have to keep in mind. Now, most researchers believe that for a corporate wellness program to be sustainable and to yield good results in terms of beneficial ROI, the program must be ongoing for a few years. It is not unusual for a positive impact from corporate wellness initiatives to be noticed only after 2 to 4 years of program implementation. For a program to be cost effective and improve health in the workplace, it should be designed so as to attract at least 80% of the workforce. The best way to ensure high participation rate is through incentives that drive participation in the corporate wellness program. And the most common incentives which include could be reducing the medical copay cost, gift cards, flexible benefits, certifications, to just name a few. Now, let me share certain ROIs which is proven in Cerner and how effective they have been over the years. To start with, what we have seen as an ROI is from the flu shots. There are umpteen research and survey results which justify the ROI of flu shot, wherein the spent versus ROI stands at 1:3, with 29% fewer lost days for flu shot recipients. Having immunization records for your associates pays off in long run, and in Cerner India has the immunization record for their associates for the last 6 years. The second one that we have seen is ROI from smoking cessation programs. Studies have proved that the cost savings from such programs is immense. Through reduced absenteeism and reduced cost arising from disease and disability, as 10% of smokers live with smoking-related illnesses and are a heavy cost to the company through health costs and reduced productivity. Now, what measures an employer can take to assist in smoking cessation? I would say start with communicating to employees on cessation benefits. Second is to adopt a long-term approach to smoking cessation that supports multiple quit attempts. And third is promote a workplace that discourages smoking and encourages healthy lifestyle. These are common, these are basic, but works wonder. So what Cerner does is it involves a certified health coach in guiding, mentoring, and checking on relapse while they have consultations on regular intervals with the associates. With attached incentives and benefits acknowledged by the associate, it becomes easier than difficult for an associate to quit smoking. Now, the third ROI that I'm going to talk about is through health risk assessment. Now, it is something that employers are using to design programming that effectively targets current health risk factors. It is also used to measure the long-term impact of wellness initiatives. The fourth ROI that Cerner has seen is through fitness programs. Fitness is a measured tool. Having a fitness specialist guiding you on what is right and how much is right makes all the difference. Cerner has a fitness center with technology model with assisted fitness specialists guiding the associate on what is right for each one of the associates who walks in to work out at the center. This does not limit only to the cardio, but also extends to the strength training, weights, functional training, stability, and the group classes. The fifth one is ROI from the obesity management program. Well, I would not limit to just obesity management program, but this is all-time favorite among the associates and tried and tested for over a decade in Cerner. We name it differently every time, but the aim for the associate is to set their goals which they intend to achieve in the next 30, 60, or 90 days. We name it as Commit to Get Fit or Healthy Watches to initiate the excitement, followed by the BMI measurements over the span of the program, consultations with a nutritionist, and follow-up on their goals by a registered health coach. The care coordinator would ensure to pool in everyone in care model to ensure and assist associate achieve what they intend to do in a healthier way. This is the model that we follow in Cerner, and we call this as team care model. Now, Cerner does not have a typical clinic or a typical fitness center. It is an engagement platform in a personalized manner. Cerner philosophically believes in separating the word health and care. You often see them written as one word, but we deliberately separate them. We believe that there is too much of emphasis on reactive sick care than proactive health. It is our desire to keep our associate healthy. The program designs span the continuum of health and care. There is strong emphasis on education, prevention, and empowerment. Associate being the member who would need medical, social, or emotional assistance is guided by an in-house physician, health coach, nutritionist, care coordinator, and fitness specialist. As an example, an associate needs assistance with certain medical condition, or per se, his or her blood pressure is on higher side, which needs constant check and certain lifestyle modification before he or she is administered via drugs or maybe a surgical intervention. A real-time example to this effect at Cerner was one of the associates who was suffering with HLA-B27 positive case. HLA-B27 is where an associate has higher than average risk of developing or having certain autoimmune disease, and this particular associate developed reactive arthritis. The associate was unable to move around and was confined to chair at work and bed at home. He joined one of our structured programs named as Commit to Get Fit, which was a 90-day program, and he had his goal set as, it was quite a simple goal, I would say. He wanted to walk and be a normal human again. While I call it as a simple, but for him it wasn't simple. It wasn't so simple. The care team, what we call our clinical and fitness team colleagues, had various consultations, diet charts, goal measured, mapped for him, and after 90 days, the same person was able to do 100 push-ups, work out of the fitness center for over an hour with high intensity, and could regain his self-esteem. He attributes all of these to the bunch of clinicians and fitness specialists who have worked along with him in his health journey and still are guiding him constantly. There are many such healthy stories that we have created over the years, and this is what we call as engagement, because this is where we try to have the continuum of health and care through our three main aspects of get well, manage well, and stay well. Some of us are very healthy and some of us are on the healthier side of the equation and some of us are quite ill on the care side. But most of us are somewhere in between, hopefully on the path to health and not regressing towards care. It is our goal with the Healthy at Cerner programs and services to meet our associates wherever they are on this continuum between the health and care and help them get to the healthier side. Now, our health and wellness journey has been a learning experience. We are data-driven. So each year we spend time looking at the numbers to understand our pain points, which better enable us to enhance the design of our program. Some things work, some things don't. Our associates drive Cerner's future and their engagement and participation helps us to improve year after year. We are committed to providing convenient, holistic health and care offerings focused on prevention and education so our associates can lead a healthiest life. We strive to empower our associates and their family to obtain their optimum level of health by offering a consumer-driven health plan, various wellness programs, and high-quality on-site services, which we have in our center in Bangalore, and that includes on-site clinic, pharmacy, fitness center, and cafe by offering healthy menu on the platter designed by our chef and nutritionist. In addition to helping us lower our annual health plan cost and maximizing the use and value of our on-site clinic, we have increased our associate engagement by over 80% throughout this year. Technology is an enabler. It allows us to scale messaging. The technology helps to personalize and give people a platform to interact with their health and wellness. Being a healthcare technology company, Cerner constantly thinks about how to leverage technology to personalize our associates' journey and help them become a healthcare consumer. That may differentiate us from other employees in the benefit space because it aligns with our DNA as a company. We believe that healthcare is personal and it can sometimes take a lot of manpower to make it personal. So we leverage technology to make it more personal. Well, I would say Cerner will continue to offer associates and their families the very best to help them get well, manage well, and stay well, and ultimately live a healthier lifestyle. Well, I would like to say that, and this is our emphasis throughout Cerner worldwide, that healthcare is too important to say this thing. I would take on any questions that you may have.
So we have a few questions, Prashanti. Is there any one specific effective method to arrive at the corporate wellness question?
There is no specific method to arrive at corporate wellness questions. As I stated before, it's more to do with having certain best practices in place. So, like I said, if you have an organizational commitment and organizations are looking for changing the pattern or the behavior pattern on the wellness front for their associates, then it becomes like a kickstart for them. However, there are various factors that are involved, and as I stated, there are certain programs that you could take off, which will give an ROI, but it's not an overnight job. It's like you need to wait for 2 to 4 years to give you a result of what you're looking for, even with regard to the claims pattern for that matter.
Thank you, Prashanti. This question was asked by Sadhana. We have another question by Gaur Malik. Can we get some insights on the average cost per employee for the wellness benefits offered among industry?
Well, it depends on, I would say, what you're looking for. like you just want to run a flu shot and a health risk assessment and do a structured program, then the cost would vary. Or if you want to establish an on-site clinic with a fitness center and run a structured program throughout the year, then the cost would vary. If I'm looking at an average cost, I need to know average cost based on what you're looking for. So it varies from companies to company, and that's the reason when I was talking about having certain factors in mind, I always said that what you are looking for. For us in Cerner, we look for the ROI, and we have seen that proven as flu shots, cessation programs. We run a lot of condition management programs because we have that data behind us. We have maybe 5 years of data behind us wherein it says how an associate is performing with regard to his lifestyles. So that's the reason. And for us, our associate population does not limit just to an employee, but also extends to their family members. So we know the pattern and the family history altogether, and that's how we leverage that technology input in giving certain offerings to our associate. So if you're asking about the average cost, then I would say based on what you need for your organization.
Thank you, Prashanti. Just another question. If there is a need to have a wellness activity, how do you convince leadership team for extra budget?
Good one. Okay. So, well, I would say you need to tell them about the ROI and show them the long-term prospects. Anything short-term would not work. And I'm sure leadership would also not look at a short-term prospects or a quick payoff. We always call them a quick payoff, and the definition of the quick has to be modified here with regard to wellness. So now if you have to put things across to management, we always show them numbers. We started off, I would go back to the history of Cerner, how we started off, wherein we just started with the flu shots. We collated the data, we took out the reporting structure for that data, and then we structured another program onto it, and then we did the labs and biometrics. We collated that data, and that became our baseline data. And that's how we had presented it to our management, and now we have 15,000 square feet of clinic, fitness center, and education space for our associates in Bangalore.
Thank you, Prashanti. We have another question that you mentioned about benefits of immunizations. So what are the healthcare problems you were able to address because of this?
Benefits of immunizations? I would say the common ailment that we have seen in our clinics or otherwise have always been with regard to, I have cold, I have cough, I have fever. And these are quite common. Now, if you track down your absenteeism as well, these are the common ailments for which we or our family members, because of our family members, we take off from our work. So I think the first to get this rid of, we started off with flu vaccinations from 2010. And that's when we have seen a pattern in the decreased rate of our absenteeism. The reason I'm taking an example of Cerner is because it's a proven record. And that's the reason I'm giving you that from 2010 to 2016, what we have seen altogether, that we have reduced the absenteeism by 30% here. So I would say the common things is flu, cold, fever, and your whatever infections. Rest all immunizations are based on how you react to particular allergies or whatsoever. I'm sorry, someone was again and again asking on the HRA, it is health risk assessment.
Thank you, Prashanti. There is another question regarding the flu shots. The shots are the vaccines which are meant for kids as a belief. So how do you encourage adults to participate in that?
Oh, who said it is only for kids? Oh my God. It's for everyone, I would say. I'm sure everyone is susceptible to a flu or a cold or a cough, and it is not just for kids. If that is the notion, I think that's a wrong notion. We give it for all our associates and their family members, and for us, the family includes spouse, children, parents, and parents-in-law. So we administer the flu shot for all of our associates and their dependents.
Thank you, Prashanti. There is another question by Jyoti. She asked, how are challenges and changes of employee engagement come across in the organization?
We face a lot of challenges with regard to employee engagement. But there has to be something innovative happening every time. So best simple thing is just hire creative minds. But that apart, I would say is we always come up and tweak. The baseline of our offerings would be same, but it's how you present it to our community. I will take a best example on condition management. Now, what is a condition management? It could be dyslipidemia. Now, what is dyslipidemia? It is bad cholesterol. So we have the baseline data because we have done our labs and biometrics. So we know who are the associates who are into that danger zone or in the mid-danger zone of dyslipidemia or bad cholesterol. We address them, we call them, first start off with the lifestyle changes, introduce certain structured programs, make it very enthusiasm. Now, since we have a team care approach wherein we have a physician talking to you, a nutritionist talking about your diet plan because you need to change your eating patterns, and a health coach checking on you again and again, and also a fitness specialist ensuring that you do a lot of cardio for your bad cholesterol. So all these factors contribute, and while the fitness specialist will just not ask you to do a cardio, but engage them in a certain workout pattern which gets them enthusiastic of coming down and working out. Because it's like a soda bottle effect, or I would say New Year resolution, wherein you kickstart like full of enthusiasm and it dies down. But there has to be an engagement level going on with the particular associate because it is an associate to a clinical team or to a fitness specialist than a group. So their engagement level has to vary based on each of the member. Though the offering of the program could be for a bunch of associates, but when you're engaging someone, it has to be at an individual level. So, and this we have tried, tested, and I think our participation has increased over 80% in the last year itself. So we are successful in that. And we are about 3,500 associate based in Bangalore itself.
Thank you, Prashant. We will take a few more questions. We're getting a lot of questions from our attendees. There's one question from Usha. How to make employees participate in the wellness initiatives and activities, even after providing ROI and long-term results, still involving employees is a challenge? Introduce
incentives, I would say. There was a program which happened about 6 to 7 years back, wherein it wasn't a structured program, but this kicked off pretty well, wherein we said that an obesity management program. So whoever loses, whichever group loses the maximum weight happens to go with a group to Malaysia. Now, everyone was enthusiastic. Everyone stopped eating. Everyone said that, okay, I'll eat only fruit, I'll eat only vegetables, I'll eat only raw. And there was no connect between what they are doing versus how it is affecting their health. And that's when we had to introduce and get into our team care approach a nutritionist. This happened about 7 years back. And that's how we evolved and developed ourselves. And once the nutrition came into effect, that's when we saw many changes. Now, it's just not that the nutrition is guiding them or something. It's the incentive actually that kicked off. So any program that we run, so we run about 5 to 6 programs every month. And every program that we run, we have the participation of about 50 to 60%. And the engagement has only increased because of the incentive, because we make them realize that there is something that is changing within you. We have also leveraged on our technology. So technology with regard to not just their medical records, but also with regard to having the member spotlight, talking about them, putting their stories and their life changes on our intranet. So that inspires others. It's just contagious, I would say.
So as we are on this ROI thing right now, there's one question from Sujata. How to calculate ROI? Can you quote one example?
Okay. There are varied formulas available. However, what we do is quite simple. Now, we know our spend, and then over the last, I would say, 2-3 years, what we calculate is, this is a collation of a lot of data input that comes in through. So we sit with various departments that we have within the HR fraternity, within Cerner and pull in a lot of reports onto the absenteeism. If I have to take the flu shot as an example. So on the absenteeism, what kind of absenteeism it is, how frequently is the member taking the time off, and what are the reasons for that. Now, there is a lot of work that gets into, and that's where our analytical team comes in to help, and they calculate these ROI structure. However, I would share the calculation, taking one good example with you so that it is understandable with everyone. It will be a very simple example, but I would do so maybe after the call as an email to everyone.
Thank you, Prashanti. There's one question regarding the B schools. So what kind of wellness strategy can be adopted to management B schools, especially for the teaching professionals?
I would say I do not have an answer for this, but I think there are many B schools who have come over to Cerner to look into how we are functioning, what are the model we are adopting. So we do a lot of tours for our B schools and the other clients or the corporates or hospitals that come in and see our living lab. So we have become like a model for them, but I wonder what they actually take back from here to teach in their B schools. But of course, from the time we have opened our center, I have seen a lot of them coming and visiting us. I'm sorry, I don't have an answer on what they teach there, but yes, they take this as a model.
No problem, Prashanti. We have a question from Meghna. She says, we perform a lot of wellness activities at Tech Mahindra, pan-India and globally. So while catering to different regions at the same time, which are the best practices that will derive good ROI?
We also cater to 3 different locations within Cerner. Now, what we do is, I understand that there are certain activities that has to be done on the same day. And the best example I could take is International Women's Day. So let's do the stuff on the same day. Well, we try to not do this for various reasons, and we try to divide that into that whole week so that we concentrate on each and every location separately. Now, this is because we need maximum participation. This is because we need to involve leaders. For every program that we do at each of the location, we ask the leaders to stand first, because they are the crowd pullers for us. They are the ones who would ask the associates to walk up from their desk and come and attend certain programs. Without the consent of the leaders, nothing can happen, and you would not get an ROI. So my first thing for ROI was organizational commitment, and org commitment is prime, I would say. Even for any program that we run here, I start with leaders. Leaders come down, they get their flu shots first, and they drive it internally within their orgs or the processes or departments, whatever you call them as. So that's how my ROI, that's how my participation has reached about 80%. It is at 84% as on date.
Thank you, Prashanti. There is one question from Rupa, that how to motivate employees to participate in structured program apart from incentives.
Okay, so we have there are various mediums. Maybe I can pick and choose few of them. And if you need more help, probably Rupa, connect later offline. But yes, so what we do is that we have our on-site primary care physician. So whenever a letter from our physician goes to our associate population, we see a huge chunk of associates coming down for these structured wellness programs, because they take a physician advice more than any other advice. So they come down. That is one medium. Second medium is through our calling from our care coordinators. Our care coordinators are our nurses or our member service specialists who call these associates and tell them that, hey, I believe that your BP is on the higher side. I believe that your bad cholesterol is on the higher side as per the reports that we have observed. I believe that your nicotine range is on the higher side. Would you be interested in coming down and looking into that? And then that's when they come down, and then they get into an overall team care approach and into the structured program. Now, I would not say that you will be successful in the first year or second year, but this becomes a continuous process. And there are various mediums to this. A basic medium is mailer, your internal post, I would say a mail from a leadership going down, whatever. I mean, there are various things that we have adopted and we change our patterns every now and then. But these are basics that worked for us like wonders.
Thank you, Prashanti. So we'll take one last question. This is by Sajal. What are some of the new age technology initiatives which are being used in Cerner?
Good one. I love this question. So onto the fitness center, I would say we have Technogym model. So all of our equipments are from Italy, wherein it's Technogym based. So we have smart key and cloud-based programming. So suppose it is Prashanti, and Prashanti needs more of cardio and little of strength and functional. So all those exercises are programmed for Prashanti, and when Prashanti walks into the center, puts in her key in any of the Technogym equipment, it tells Prashanti how to do, how much to do, and when to stop. So my dependency on a fitness specialist would be minimized because my system is telling me what I should do. If I don't want to see what the system wants to tell me and I want to do any of the workouts that I wish for, I can just watch on YouTube or a movie or a news or work out with checking my mails or whatsoever. So this is something that we have leveraged upon. That is onto the fitness side. Now we also offer some certain kind of the Group X classes, which include Pilates, body flex, yoga, Vinyasa yoga, Zumba, Cerner cycle. We call them the cycling as Cerner cycles. We name them differently, but yes, we have introduced many Group X classes, and that has maximum participation for us. Coming to the education space, we have webinar broadcast, or we have classroom sessions when it comes to showing them certain techniques, and we get into varied lines. Now, one of our famous patterns that we have seen in the classroom session is focusing on women, like women on weights. We call that as WOW because it is women on weights. So the WOW program has been running pretty well for us because we always feel that lifting weights is only men's job, but actually if a woman wants to lose their weight and have a flat tummy, then they have to lift weights. That's as simple as that. So we have this program structured, so it is a 12-week program that goes about. And then coming to the clinic side, since we have our EMR and we have our on-site lab facility within our center, we also have a pharmacy. So everything just happens within, and that's an offering that we give it to our associates.
Thank you, Prashanti. That was indeed a very nice session that we have just heard. So, and with this question and answer session, we are going to wrap up today's webinar. Once again, we'd like to thank today's webinar partner, Sanofi, and a special thanks to our speaker, Prashanti, for this webinar and all the valuable information that you have shared with us today. And I would like to thank everybody in the webinar audience for participating in today's presentation. We'll be coming back to you with many more such webinars. That concludes today's webcast. Thank you and have a good day.
Thank you so much.